Good afternoon, everybody, and welcome. I said it was live stream. Good afternoon, everybody, and welcome. Just to begin the meeting now formally and introduce ourselves. For myself, I'm Margaret Parker, and I'm the chair of the board of Healthwatch Rochdale. If I go across from where I'm looking at, Naomi.
Good afternoon, everyone. I'm Naomi Burke. I'm the Engagement and Volunteer Manager at Healthwatch Rochdale, and I also lead the Youthwatch Rochdale.
Ben, just in the middle of your drinking.
Hi, Ben Greenwood, Vice Chair of the board. Hi, everyone.
Kate.
Good afternoon, everyone. I'm Kate Jones. I'm the Chief Exec here at Healthwatch Rochdale.
And Melanie.
Hi, I'm Melanie Tunnett, and I'm a board member and director at Healthwatch Rochdale.
We haven't got any apologies as I'm aware of, but I know that David's missing at the moment, but I know he was trying to get in, so it might be something to do with the connection for the system. So hopefully he'll be able to sort that and be able to join us fairly soon. In terms of the second item, it's questions from the, thanks for bringing that up, Kate, for me, appreciate that. Questions from the public is the next formal item, but I've not received any formal notification, so I'm assuming none has been received.
No
Right,
questions received, no.
Approving the previous minutes. Is anybody?
I apologise, these didn't get sent out, so I'm going to have to send them out after the meeting for approval via email, so sorry about that. I don't know why they didn't get sent out. I think it's because I put NA on the regards to the paper. I
see. Righto. That's okay. So we can just agree that formally a separate meeting of the subcommittee, I think, in terms of that, rather than formally for the meeting today. In that case, it will be an issue about any matters arising coming from that, because we won't have any. I wasn't present at the last meeting, so I wouldn't be in a position to comment on anything from there. And I also understand there were no actions carried forward from the last meeting either, so there's nothing further in regards to any of that.
No, and in regards to the minutes, there wouldn't really be any matters arising. It was all updates, so
righto.
Yeah,
thank you. Any declarations of interest at this stage? No. Right, thank you. So we go straight into the next item. We're doing really well getting through these. Healthwatch in Greater Manchester update. So Kate and myself have not had a formal chance to agree the input for this, but I said I'd start off with some of the information I had. And again, I'd want to apologise because as I wasn't present at the last meeting, I'm not quite sure where we're up to in terms of our updates in regards to what's going on at the network meetings. But so do forgive me if I'm repeating anything. As you know, I hope from earlier discussions, we've developed and agreed a partnership agreement with a Greater Manchester ICS system, with the ICB board. And following on from that, we put in a submission for funding. We got a very late notification in this year of a 3-year grant for funding to support some posts to coordinate the activities of the network and to be the contact point and liaison point with the ICS system. And we're pleased to receive that notification. At the same time, we got the notification, we have received a resignation of our chair, who's been in place now for 2 years, Tracy McErlin, who's put in a lot of work and a lot of energy into making sure the systems are in place and get us much more professionally operated as an organisation, or a group of organisations, more accurate. And so when we moved to the next stage, we moved to recruitment. We recruited, or successfully recruited over the last few weeks, a independent chair to be funded through a remuneration, and a chief coordinating officer. And I was involved in all of those interviews, and currently we're waiting for subject to clearances, but we're hoping that they should be imposed by September, and gave very, very good interviews and can't find themselves. The chief coordination officer's name is Daniel Ruane, And the chair, independent chair, is Chris O'Gorman, who's done a lot of work within the Bury area, but also has an independent consultancy around this area of work. But they're going to be joining the next network meeting prior to their formal appointments, and hopefully will be in a position to clarify what their induction arrangements be and what was going on with regards to that. Since getting the money, we've actually had a lot more attention given to us as a Health Watch, and keenness to be represented, for having us represented at the ICS governance meetings. So there's a whole range of them that we've been invited to. We were invited to a few before, but they've increased considerably since then. And in particular, we've got reference to attend at things like the Quality and Performance Committee, Integrated Care Partnership, the Quality and Inequality Assessment Panel, Engagement, Inclusion and Insurance Group, Quality Delivery Group, Children's Commissioning Group. It goes on and on. What it's also shown us is that we've also been increasingly asked to be involved in providing much more information to these meeting forums, and that is going to put a pressure on the team in regards to having monthly and quarterly detailed reports that they'll be putting through with information data on our activities, our engagement, and on the data that we hold in regards to the information from the public. At present, it's a bit unclear about how that will actually be organised, but we're trying to tidy that up. But hopefully we'll keep you informed about how that's going and what that entails for us as we go forward. I know that Kate's been involved in some of that work already in terms of supplying information, and I'm aware that our annual report was actually formally submitted and considered a Quality and Performance Group, and where they particularly highlighted our key successes over the last year. And so I think that's quite a positive thing for us. And certainly I know that Kate's been providing information to them around our engagement activities, as I saw reports submitted in the last few weeks. Kate's been involved in a lot of other operational activities and is leading the officer group until the new chief coordinator officer is coming through. And if you want to add anything in regards to some of the work that you've been involved in, Kate.
Thanks, Margaret. So we set up a Greater Manchester SMT meeting. So it's the chief officers and managers from across the patch, chance to come together, try and bring some of our back office functions into better play. If you think we're 10 micro organisations, and between us we sign up to various licenses and things like that. So really thinking about how we can perform better as a 10 GM. Also thinking about how we can be business ready as an operating 10 organisations, delivering on our statutory functions at that Greater Manchester level. We've been thinking about that. Our first area of work that we've concentrated on is volunteering, and thinking about how we all do that individually and locally. Thinking about our different demographics across each of the 10 boroughs in Greater Manchester as well. So we've got a paper coming to the next network meeting, which the SMT group have discussed at length, to see what's next around volunteering and how we can bring and pool some of our volunteers together as we move forward and start working closer together as 10 organisations, thinking about what area is most likely to be needed. So enter and view was a key top area, and obviously at Health Watch Rochdale we've been doing our enter and view programmes for a good few years, so we'll be looking at leading on some of that work. So it's been a really great opportunity as well, just to come and have a catch up in regards to what's going on. What we're finding is we're all being invited to different things at a GM level, and we're all having different levels of involvement. So for us to be able to come together and have those conversations, it's really positive. So as Margaret said, as Danielle comes into post, she will take over the delivery of these, but I have been chairing and minuting and everything else in between these meetings so far, and I'm really pleased to say that they've been really successful and well attended. That's everything from me, Margaret. Thank you.
Yeah, thank you. Any questions or any comments that anybody wants to make around that? Is that sort of whistle-stop tour about where we're going in regards to some of the work that we've been undertaking at the network, which has been quite intense over the last few weeks?
I'd like to say just how positive it is, because it's so important that we work collaboratively across GM and to become more involved and more mainstreamed with some of these groups. I think is very positive. So it's good news all around.
I think you're absolutely right. I think what we're going to try and have to think about as we're going forward, though, is how we balance the two things together. I think the local pressures alongside some of the GM work, which is, as has been highlighted, is increasing considerably. But we are hoping that the appointment of a chief coordinating officer and a dedicated chair who can give quality time over and above the local work to supplement what's happening should give us some real ability to actually be much more proactive and more engaged at the GM level, and that we can bring a much better communication between the two as we go forward. Right. Thank you very much, everybody. So if we move on to the next item, which is the annual report, if I hand that over to Kate.
Thank you. I'm just bringing this up now. You should be able to see this. So it's a statutory requirement for Healthwatch, all Healthwatches, to produce a annual report to highlight the work that's been completed on the previous financial year. That report has to be completed for the 30th of June every year and sent to our local organisation, partnership organisations, and Healthwatch England. So the report has been published. I think it's good to share the report. The board obviously approved it at the last meeting, but just to really highlight some of the information in the report. The report's been published, like I said, and I've been reporting on it at various statutory meetings across the locality of Haywood, Middleton and Rochdale. So I'm not going to flip through the report. I can't do two things at once. So I'm going to talk through it. But this is just to sort of like make it relevant. So obviously this is reporting on our financial year of 2022 coming into 2023. So during that period, we spoke to over 450 residents who told us various information about their access to services across Haywood, Middleton and Rochdale. With those experiences, we've got in place various things that we do with that information. So the feedback that we receive, we bring into the care system, and we share that with data sharing agreements. So, for example, we have a data sharing agreement with the primary care team. So we share our information into that, so that it's having a bigger picture on their information that they're reviewing. We signposted over 345 residents to various local organisations. A key one being GM Dental Emergency Services. So that's a lot of residents that are coming to us not knowing where to navigate the system, and we step in and support them with that. We published 5 reports with recommendations into the health and social care integrated system, and a lot of those reports are actually continuing on as pieces of work in this work plan for this year. So some of those reports we started our end-to-end view programme, and we did an outpatients end-to-end view, and we did the urgent care end-to-end view. We did a piece of work on menopause services due to increased feedback of lack of information available. We did some continuing work around the Alkington Hub and what was previously known as the Moving On service. So these key reports have gone into the system with recommendations. Recommendations will come back, and like I said, this financial year we are continuing to work on these areas. Throughout that last year, we had 60 volunteers throughout the business supporting us with our work that we do both on the ground, online, through focus groups, virtual involvement. So without those volunteers, you know, Healthwatch wouldn't be what it is. And I think it's a key group is the advisory group in regards to the work that they do in scrutinising our operational running and reviewing our feedback and reports that come through. Another big piece of work that we did was the PPGs. We did a deep dive into the PPGs to see who was up and running, and that made a massive impact in regards to the changes that were made within the services. PPGs have been stepped down since COVID, and it was they all had to be reinstated for April. And again, we've been continuing to support that, but that was a major piece of impact, that it was a contractual requirement for PPGs to get back up and running. In regards to some of the operational strategic work, the strategic work that we were doing, throughout the year, we worked on a diversity award to really show how inclusive we are as a workplace. And the report highlights that we became 11th out of 100 most employable around our diversity. So a really positive piece there. Another area of development at strategic level was a Quality in Action award, which we received. which Naomi spent a lot of time on this. So it's really looking at the framework of the organisation, specifically around our volunteering offer. And we were the first, I think now, organisation within the borough to receive this award. So really positive, and it really showed us how good our infrastructure is, our governance structure. And it was just a few tweaks that we had to make along the way. So really pleased with that. We've done a lot of work with our Youth Watch over the last year, which continues to develop a lot of co-production pieces where people have come and spoke to the group virtually to get their feedback and to consult with them on various things that happen across the borough. Again, Nye leads on that piece of work, and really positive feedback in regards to new members coming through and the participation within our Youth Watch 100 surveys. So what have we got going on this year, just around the annual report up? So key areas of work for us this year is our care home enter review and starting that process back up, which we're really looking forward to getting on the way with. Primary care development. Now that's quite a broad sort of bullet point, but actually primary care is so large for us at the moment. It's where our feedback is most prominent around dentistry and GP access. I've been on a call this morning around the Greater Manchester primary care engagement that's going to be starting, and really keen to get involved in that at the GM level and then bring that down to the locality to ensure that, you know, at neighbourhood level people understand what's happening around the primary care changes. And then a key area for us finally is our health inequalities, and ensuring that any health inequalities that we highlight within our work are brought to the forefront of the the professionals that at the point of service delivery, and at working at that strategic level to ensure that we can make changes there. So a bit of a whistle-stop tour on the annual report, just to say thank you to the team. Really positive report with some really good impact in there. I mentioned the advisory group and our volunteers, and also in the report it highlights our superstars volunteers, and also the fact that obviously Margaret joined us in the last financial year as chair. So unless anyone's got any questions.
No. Just an observation again about how well you've done as a team over the last year, and we've all appreciated that as a governing body for the Health Watch. And to say that the report was very well received at the quality and performance at the GM level, and it's great that it's received the acknowledgement at that level as well. Thank you. So, is any other comments? Any other observations? Right, thank you. If I see David's been able to join us, pleased to see him. If we go to the next item then, which is the advisory group report, which I'll hand back to you again, Kate.
Thanks, Margaret. So I have pulled the report up on screen, and I will slow down this as I talk through it with us live streaming. I think it's just good to highlight this report. So this report is getting longer every quarter, which is good in some ways, but it does mean that we are busy in these work priorities. So the current work areas identified from data intelligence. So menopause services were identified in the last financial year, but the work continues on. A formal report went into the system after I was doing some engagement, both through surveys and through focus groups, to see, you know, what level of service was out there. So the key findings are identified there. So this report has gone on, and we've had a response on those findings. There's further work been done after a bit of backlash from the system, health and social care system, questioning our demographics on the report. So Naomi has been away over the last quarter doing some engagement specifically around our minority groups within the borough, and really focusing on those isolated communities that don't always necessarily get a voice. We've got some focus groups running throughout the next quarter. We've got some in August coming up, where we're really looking at going into the communities and talking to women that don't always, you know, talk about these taboo subjects. So, sorry, let me just go down. So it says there that we've been engaging. So what's next? We've got focus groups with our ethnic minority women. And we've got a further survey that was specifically to reach the people that we didn't get enough responses. And there'll be a phase 2 report written and sent into the system. Really interestingly, menopause is a key area at the moment, and there's loads of things popping up across the borough in regards to supporting women through information signposting. The end game here is to create a leaflet to ensure that there's local information out there, you know, for our women across the borough. and we've got a lot of buy-in from clinical specialists across the borough as well. So really exciting piece of work in regards to getting this leaflet developed. We know what people want in it from the engagement that we've done. So it's just a bit of a waiting game now to get the report finalised with those recommendations. Moving on to the next area of work, we've got our pharmacy services. So pharmacy again was raised in regards to our feedback trends, in regards to just poor service, delayed response in regards to key things that was going on there. Our findings from our survey, we made 4 recommendations into the system. That formal response is due back on the 4th of August. There's been a bit of a delay in regards to some of that information coming back. But what's next? We've got a lot of work to do around our pharmacy work. So we've got our mystery shoppers, which are going to start in the summer. And this is specifically around our minor ailment scheme and needle disposal. So 2 things that people brought up to us. So we're just waiting on further information from the Greater Manchester system to make sure we've got our right information in regards to which services are signed up to deliver this. There's quite a lot across the borough, and we do know that a lot of them aren't advertising, especially the minor ailment scheme. So really interested to see how this work develops on. Patient participation groups, again, you know about this piece of work. We did a deep dive last year. On the back of that deep dive, obviously the commissioners confirmed that the PPGs need to be reinstated. Healthwatch Rochdale created a guide for practice managers and shared that across the system of, you know, an example of how a good PPG should be run. We also went out to support with the recruitment of new volunteers. So we've got a handful of, well, a big handful of people that want to join their local PPG surgeries. However, there's a bit of a delay due to data protection and GDPR. So we're just waiting for the data sharing agreement to be signed off by the Commissioner's DPO, and then that information can be shared with the individual practices. We are due to go out in Q2 to do a quick deep dive to see how these PPGs are, whether these PPGs are back up and running, and that the information's on the website. So further work to be done there. We've got our Alkington Hub engagement, which again is continuing on from our moving on service reports. The report is in the system at the moment with key recommendations, and we are just waiting on a response, which is due again on the 4th of August. So just to highlight some areas of outstanding practice and innovation, we tried to change things up a little bit in regards to just constantly receiving negative feedback and see how we could spin that and share that positive news that we're getting. So we do that by our Feedback Fridays in regards to good services. Our innovation, especially around our end-to-end view and what work we're doing there. And in addition, we ask people to share what is working well, like I said, and not always pulling out those negatives. What work have the advisory group specifically done to support the organisation? For the last 3 months, they've given over 20 volunteering hours. Now, due to staff capacity, 2 of the advisory group meetings were stood down. One of the meeting and then a development session were stood down for the advisory group. So our hours are slightly down for this quarter. However, it still shows that, you know, the interest is there and people are still getting involved in the work that we're doing. So an update on the red flag issues that have been identified across Haywood, Middleton and Rochdale over this first quarter. So memory clinic delays. So at the moment, for an initial appointment within the memory clinic, it's a 13-month wait. So this has been highlighted with commissioners, and we're receiving regular updates as what the service is doing to improve this. Number 2 is the ADHD service. So there is currently no service in HWR that is offered to residents. The service was pulled over 12 months ago due to the CQC being involved in Lancs UK and medication administration and errors that was happening. So the issue here is that across the whole of Greater Manchester, there's 15,000 people on a waiting list for either an ADHD, to check whether they've got ADHD, initial referrals, medication reviews, next steps in regards to once being diagnosed, what's next for them. So locally, we've been told that they're looking at a Greater Manchester approach on this. However, like I said, in Rochdale specifically, we have no service. So there's been more pressure being pushed onto GP because service users of us who have ADHD and needing more support. So a really big concern in my eyes, and something that we are keeping a close eye on. And like I said, the local commissioners are keeping updated on this. They did say that some comms are due to go out, so I'll keep an eye on that and keep you updated. And like I said, the advisory group are aware, and this is an area which is regularly on our agenda. Autism services in the borough, there is no current services for adults. So if you diagnose, if you do have autism, there's nothing in the borough that can support specifically around autism. So again, something that we've put into the system, something that they're aware of, and something that they continue to tell us that they're doing something about. This was something that was raised over 2 years ago to us as a Health Watch. So I'm really keen to really hold the system to account in seeing these services start being introduced. Another area is around our interpretation services, particularly being delivered at GP practices. People have been told that they need to wait to speak to the GP because there's no interpreters ready. So we've raised this with commissioners, and they've advised that this isn't something they're aware of, and to bring any specific cases to their attention. So close links there. Dentistry, which has been on the list for a long time now. People are specifically around our Bupa service in Rochdale. So Bupa pulled all NHS patients at the beginning of the financial year and told them if they could still attend, however, they had to be private patients and move on to a pre-place scheme. And then GP out of our services. So these changed after Christmas, January 23. Excuse me 1 minute. They changed in January 23, but limited information has been put out there across the borough. So obviously we're working on our PCM footprints now, which is our primary care networks, and there's limited information about who you go to out of ours. It used to be key hubs, and that's no longer the case. So we are working with the commissioners to look at getting some public information out there, but it's a key area that's been raised. So impact that's been made in the last quarter. Transitional social workers has been raised as a gap. So the transitional areas is when a child moves out of child services and integrates into the adult services, as they hit for anything from age 16 up to 25, dependent on the various services across the borough. What we found was there was a real gap in regards to autism and ADHD, and were in services. That transitional process was really difficult, and we've had a lot of feedback from carers and parents to say they struggled with that as well. Fed into the system, and I'm pleased to report that we got an update to say that adult social care are currently in the process of setting up a new transitional social worker team, which will specifically look at working with these children who are moving into adulthood at an earlier stage as well. So rather than being reactive to the, in 18, sort of like starting at a younger age and seeing as, that sort of like horizon scanning for adulthood. What we've got coming up in quarter 2, we've got an advisory group development session in August where we're going to look at the mystery shopper planning and looking at the strategic full document refresh. So obviously our strategy has been refreshed in regards to our vision, mission, aims. However, the big larger document around that needs to be reviewed. So we're going to start off by doing that with the advisory group, and then we're going out to recruit for advisory group members. I'll stop sharing my screen and I will take any questions. Thank you.
Realised I'm muted. Sorry about that. Just any other questions or observations before we move on? It's really concerning, some of the red issues that you've highlighted there, and the pretty major issues in regards to what needs to be taken forward. It's great and reassuring that you're linking into the system. Is there anything more that we can be doing, and any more monitoring that we could be doing through the subcommittees that we have in regards to some of these areas? And I was thinking maybe bringing in, checking out what's the position in the GM level or through the locality and the health and wellbeing boards and scrutiny, of course, in regards to bringing up these issues in a broader way into other settings at all. Is that of any help or any use to be thinking about?
It is public knowledge in regards to the services that have been red flagged. They've been discussed in public meetings as well. So that information is out there. I've spoke to GM colleagues in regards to SMT at Health Watch to see if it's a similar case in their areas. What's really difficult is at the moment as the Greater Manchester Partnership develop and localities work themselves out with these big changes, it's hard to really pinpoint where the accountability sits a little bit. Right. And the fact that there's so many changes going on, which we have to, you know, we're working with and we understand. But the fact that there's no services, and, you know, like I said, especially around the ADHD, that went over 12 months ago. So for me, it's a little bit difficult to keep getting the same response. So like I said, we do keep pushing that, and I'm getting monthly updates from them. And obviously, in regards to, you know, you guys having a bit more overview, I think maybe on a monthly basis during our subcommittees, I can sort of like bring a monthly report around the advisory group work that's being done, and you'll get that update on the back of that advisory group meeting then.
That's helpful. Thanks very much. I'm conscious of the fact that some of the boards that I attend on behalf of the Health Watch is that these things are not being debated and they're not being brought to the forward. And certainly I know that they've been concentrating on having children, Ellen, learning difficulty and autism as being one of the major focuses for this next year. So it's surprising that it's not being debated in those forums. And so it's something, if I have the information, I'll obviously take that on board in terms of representing the perspective and issues and concerns around it all. But thanks very much for bringing that. But can I also acknowledge and appreciate that, send my appreciation to the fact that we are now doing a lot more work on focusing in on our seldom heard groups as well through the work that you've been doing through the advisory group. Much appreciated. Thanks very much. Any other comments before we move on?
Just to concur, Margaret, with what you were saying about thanking, you know, the advisory group. There's a lot of work going on there. And I also agree with the red flags, the concerns around the red flags. As Kate said, you know, that some of these are not new issues, but it's like, who is accountable and what is the direction of travel with them? Because it just seems very stalemate at the moment for some of those services.
Yeah, absolutely. Thank you. Right. But I also feel, just to finish off with, you know, I know all the pressures on.
Sorry, Margaret, can I come in, please?
Oh, sorry, I didn't see your hand up there.
It's okay, it's okay. Yeah, just no, I think I concur with everyone else. It was a very good report, this. I just wonder, this is just because it was anecdotal, because you know, I did that, Claire, I should say, did that very decent interview with me about epilepsy services, and I couldn't thank her enough for that. It was really, really impressive piece of communications. That there's epilepsy, because I've had a couple anecdotal come up to me after that article say, yeah, it's not great. Has that been escalated as a red flag by the, well, obviously it hasn't, because he wasn't in the report, but has there been any low intel about problems with epilepsy services or lack of them in the borough?
No, we've had no further feedback in that area, Ben. Right. We've had a really positive response to the actual, you know, the information that was given out, like the campaign that Claire did, but we've not had any increased feedback in that area. So a little bit disappointing that we haven't. That's why it's not down as a red flag. We have to have enough information. Of course,
you know, you do, Yeah, as I said, I had a couple of people come up to me in the pub and stuff, but that was about it, really. So if you want to watch it, guys.
Come on, Ben, that's a difficult thing. People will come up to us and maybe tell us stuff, but actually getting that information.
Getting them to, exactly, absolutely. That's what I mean. That's why I didn't progress it further, because it was just, oh, you know, like that sort of thing. But if you want to get them to do anything official, they don't do this. So.
No.
Well, thanks again.
Right. Thanks very much. So if everyone's okay, we'll move on to the next item, which is the Health Watch Rail quarter update. Is that Naomi going to take the lead on that? Or are you sharing it?
Starting off this bit.
Yeah.
Oh, super. Oh, I do like that picture. All right, so I'll just do it. I will try and keep it brief, because you know me, I do like to waffle on a bit. We'll start off with our youth watch, our youth involvement. We're getting really, really, you know, like wheels are rolling now with our youth watch after, you know, like really struggling on for a couple of years. We have now made some really good key contacts We've got some excellent Youth Watch members, although our numbers are quite low, as in the actual members who come to our meetings, it has gone down to 9. They're very, very proactive young people. They take a lot of the stuff that's discussed, a lot of stuff, they take it back into their further education, they take it back to their youth groups, back to family and friends. So, they do extend a lot of the stuff that we discuss, and they do bring a lot of stuff to us. One of the things that we've been really, really excited about, we welcomed, was a work experience student from Whitworth Community High School. So she's just in the photograph there with our information advice and signposting staff. And Grace came with us for a week from Whitworth Community High. I've been with Healthwatch now nearly 3 years, and I've not had a student with me yet. And I must admit, it was an absolute pleasure to have her. She was absolutely fantastic. She went out on information advice and signposting. She helped us do loads of admin. I got hundreds of things printed, laminated and made up, which has been a massive help to us, especially like when we're going out on engagement. We don't always have things ready to roll. We've redesigned a new feedback poster for the text service, because I'm determined that we'll get more text messaging coming through that way. And she's just been an absolute asset to us. And she did really enjoy a week with us. She gave us really good feedback at the end of it. She went back to a school and told a school that she'd really enjoyed being with us and stuff. So hopefully that can be something that we can partnership with schools on in the future. Is taking on, I mean, not a lot of schools don't do them now, but it was lovely having it, and it was also really good to have a youth perspective, because I was showing her some of our posters and she's like, nah, and even like some of our social media, I'm like, what do you think of this? And she was like, well, as a young person, but she was really, really good, so we were really, really pleased to have her. Another highlight of our Youth Watch is the photograph at the bottom is Elizabeth, Elizabeth's been with us since the beginning of Youth Watch, so she's been with us for nearly 3 years now. She first came to us when she was 14. She now goes to Rochdale Sixth Form, having been at Matthew Moss prior to that. We named her as one of our Health Watch heroes when we did the 10 years of Health Watch. Elizabeth has been an absolute asset to us as a young member. She was recently awarded by GMP Rochdale Police the Callum Riley Aspiring Youth Award, because of the amount of involvement that she has across the borough on so many different things. She's also a part of the European Youth Network. She's just been recently to Romania, and she's been to 2 other places. I can't remember where they are off the top of my head, but both really prominent things as part of her youth work. She's also set up her own it's called Allyship, and it's around tackling violence against women and girls in the Rochdale borough. So she's been really, really keen, like coming to our Youth Watch meetings, asking around, like questions around that, how we as a Health Watch do it, how we could gather feedback if, she's been an absolute brilliant asset with her. She's created this allyship program, and she's actually been going out into schools and delivering it. So it's around awareness, around misogyny, all things like that. So she's took it upon herself to, create it and go out delivering it in schools as part of PHSE lessons. So she is, she's an absolute godsend. She really is. She's also, she's going to be coming up to 18 in December. So our next steps is maybe put her onto our advisory group, because our Youth Watch is 13 to 18. So I'm thinking maybe, get her up them ladders a little bit into our advisory group. Then who knows, board in the future. So she has been, she's been absolutely amazing. And again, she does bring a lot of stuff to us from, within the community organisations. And through Elizabeth, we've managed to get links to the youth cabinet in Rochdale, so we've gone along to them and got some feedback sessions as well. So Youth Watches, it's going quite well at the moment. We're getting out there quite a lot, and a lot more people are knowing about us. Our information advice and signposting, we've shifted in this quarter what's just been. So we've changed our localities, changed our locations. We've moved it up a bit. We've gone into areas that we've not gone into before. One of the areas that one of the places that we thought would be really good would be libraries. Libraries are hubs of the community. They're used for baby groups. They're used for IT lessons. They're used for absolutely all sorts. They've got citizens advice sessions in them. But also they're open all the time. They are places where people within the community do tend to go into. So we have got a number of information advice and signposting sessions from now right up until Christmas in key libraries in Smallbridge, Castleton, Rochdale Central, which is in the middle of Riverside 1, Balderstone, Spotland and Nordin. So these are all areas as well that we don't really get a lot of feedback from. So they've been very positive. So I find the libraries are lovely to go into. They've made us very welcome. So we're establishing ourselves in them now. We've also looked at where we can sort of like engage a little bit better to gather, do that information advice and signposting, gather feedback and raise awareness a little bit more. So we've moved from Nye Bevan into the Cross Sheafer, and we're now in Rochdale Leisure Centre as well. And then we're also doing monthly sessions at the Red Cross, which is based at St Mary's in the Bourne. And then we're still maintaining our connections with Rochdale Infirmary as well. Whilst we're at Rochdale Infirmary as well, we do sort of like link with the Rochdale and Oldham Maternity Voices Partnership and change their board from and stuff as well. So we're still maintaining that link within there. Our stalls are normally for 2 hours, but we're, again, Judith's been really warmly welcomed into all these different areas that we've gone into. So we're going to reassess these again after Christmas and see, where else we can target and things. So been very productive. We have been busy, even though we've been a little bit short-staffed and annual leave and things like that. We have had quite a lot of engagement and involvement in that first quarter. In April, we focused mainly on that menopause because we released that report. We needed to get them further insights, especially from ethnic minorities. So in April, we mainly focused on making good connections with local organisations who could potentially help us give that survey out, do that survey with the service users for us, or come along to focus groups. So we've made some really key connections there. We have had some quite a few surveys back, and as Kate had said earlier on, we are going to do some focus groups with working in partnership with Aspire to Inspire, who are based over to what I think it's here, I can't remember what it's called. It's in Rochdale, and also Soul Sisters, as well as Danny Butt Creative CIC, and they all have a lot of service users who are from ethnic minorities, so they're going to help us with them. In May, we were focusing on massively on that grassroots engagement, and we had a lot of really good events through May. So we did Africa Day with Caring and Sharing. We did a big cost of living crisis event at Rochdale Football Club, and we went to the Ida Hobbit flag raising at the town hall for the, which again, it's sort of like got us networking with LGBTQ communities and things. So we did a lot of that in May. In June, again, we were linking with that LGBTQ link. It's like Rochdale and Rainbows, it's the Pride Month. So again, we did some really good training as well with the Proud Trust. We've been concentrating only on one survey this quarter, which has been that menopause survey. And again, that's due to close at the end of this month in another couple of days. So yeah, we've been quite busy out and about. That's just a little montage of some of the amazing places we've been to. And we've had some really good key connections. We was invited by Crescent Radio to the health and wellbeing event up at Castlemere, which was fantastic. It was a lot of South Asian population, but there was actually GPs there as well, and there was other local councillors in there as well. So that were a very, very good event. So yes, we've had some really good engagement over the last couple of months. And we're volunteering. 1st to 7th of June was National Volunteering Week, and as always, without our volunteers, Health Watch wouldn't be half as wonderful as what it is. We massively appreciate everybody who volunteers their time with us. We have got 2 new advisory group members, which I'm very excited for. They're going to be joining us for our development day, which is in August. We're doing some very, very specific recruitment planning, and the recruitment for all our volunteering roles, including interim view, will be going out live from, I think it's the 7th of August. And over this quarter, our volunteers have given 188 hours just in Q1. So that's a whopping amount of hours that. So we're really, really pleased with that. And again, like I said before, it's amazing, the amount of time that our volunteers do spend with, even just sometimes just sharing our social media posts. It's massively appreciated. So yeah, big shout out and thank you to our volunteers there. And then our next steps. So we are well excited because we have got a bursary to go to the Health Watch Leadership Conference in London in September. So we're very excited about this. It's the first face-to-face conference they've had since well before COVID. Health Watch are very excited about this opportunity as well. So we're already set to go and rolling down on 19th of September to London. We have got our iPads at Healthwatch, and we don't really use them to the full potential I think that we could use. And sometimes we've had a problem with connections and like Wi-Fi and things like that. But it turns out that we can now use Smart Survey and the feedback form offline as well, even if we haven't got connection. So we're going to be taking the iPads out a lot more to try and utilise gathering that feedback directly onto the like into our system, so that it's an easier process and job as such. Again, with the menopause due to come to a finish is the survey, and we're hoping to get the funding for the leaflet. We have put an expression of interest in for some funding to pay for the leaflet, and do it in partnership, in collaboration with the Women's Network in Rochdale and service users. We have got the next Rochdale and Oldham Maternity Voices Partnership meeting in September. That is going to be meeting 11. So that seems to have gone so quick from meeting 1. So we're now on meeting 11 with that. As I said before, volunteer recruitment from the 7th of August. We're continuing to try and do more raising awareness sessions. We have got quite a few things booked in for over the next quarter for new organisations, new areas, new places, just to raise awareness of us, but also how they can help their service users send feedback to us. We are going to be carrying on with our enter and views, and we're going to be doing some training with Healthwatch Oldham to get them trained up to be enter and view reps as well. And we're looking forward to an advisory group development day in August as well. Again, our advisory group development day, last one was postponed, but it'll be a really good opportunity for our advisory group to get face to face as well. So we're really looking forward to this next quarter. We've got a lot of things coming up and going on. So yeah, so thank you.
Did anyone want to come in at that point and make any observations or ask any questions?
If Grace or Elizabeth need a job in the future, then let me know.
Sound fantastic, don't they? Absolutely brilliant. Yeah.
Absolutely.
I have to say, I'm impressed with what you've been managing to do, Naomi, as given the lack of resources and staffing in the last few months. You've been doing brilliantly well, and I'm really interested and pleased to see what you've been up to. Thanks very much. Should I hand over to Kate now for your update?
Thank you. I apologise because my slides are never as fancy as nice. Never. It's not letting me click on them. So bear with me because I need to move my thing around a little bit. So this first quarter, what we've been up to, so we've had 2 formal reports go into the system, the Orpington Hub and the pharmacy report, which we're waiting for a statutory response to, with action plans on next steps. I've attended several meetings alongside Margaret, some of our statutory meetings, so Health and Wellbeing Board, Health Overview and Scrutiny Committee, the Locality Board, and Insight and Engagement and Assurance Committee. So I just wanted to touch on the Insight and Engagement Assurance Committee a little bit more. This is an assurance group which is being set up, which will feed into the Locality Board, specifically around any engagement that is going to be needed across all services, not just health and social care, but also the insight in regards to data sharing. So this is a really important group moving forward, and I'm working with the chair, who is a public health consultation, to look at how we can link this insight and engagement group with our Together Rochdale comms group. So if there is something going out for public consultation, how can the Together Rochdale group bring that out and make sure we've got one message going out further? So I'll keep you updated on that group, because it is key, specifically around the health and social care changes that are coming up. The LCO currently have 30 streams of engagement that need to be done. So we're really keen to assure this process to make sure that the engagement's done to a set standard, and the cooperative engagement toolkit is being developed and implemented across the borough for this to go ahead. So in regards to impact in the first quarter, so I mentioned the transitional social worker team being set up, which is a really positive step. Another area was I attended a parliamentary engagement event, which was specifically around pharmacy services, looking at all aspects of that. And I fed our local information in that we've done through our reporting and our surveys. The report's now been finalised, and I will share it after the board meeting. Just a really positive bit of impact, really, to bring our local information, to that national footprint. So yeah, I just wanted to raise that as the impact that we had from our local information, which we've gone out and collected. So we've done a lot of signposting this first quarter, specifically to our local advocacy services for NHS complaints, but also for mental health support around specific independent mental health advocates. Signposting to mental health services across the borough, as well as broader outside of the borough, just because of waiting times, specifically around talking therapies, which used to be IIAP services. And then another key area, which I've already alluded to, is the Greater Manchester Dental. So many people having dentistry issues, and so many people getting caught up in the system between dentists, GPs, secondary care. So it's an area that we do continue to watch really closely. So what have our feedback trends been? So dental, again, specifically around the BUPA, which I've mentioned. Prescription fines. So what we're finding is people are getting fines coming through because they're not 100% sure on what documentation they need to complete to get free prescriptions. So that's something that we're going to look at a bit more closely, and maybe look at getting some local information out far and wide. And as always, GP access is obviously a key area, and people not being able to get the appointments. So annual report was completed in the first quarter. And like I said, I've been to various meetings to deliver on a presentation on that annual report and give that update. So what have we got coming up in quarter two? So advisory group development, like I said, we're going to look at the full strategic document as well as look at our mystery shopper planning. We've got annual report deliveries, and I've still got various statutory meetings that I need to attend, so I'll be delivering it in September, health overview, scrutiny, and various others along the way. We've got volunteer and staff recruitment in quarter two. So it really should mention Claire Birch, our Comms and Information Officer, left the business in June, moved on to Rochdale Borough-wide housing. So she's still working within the borough and working closely with the team in regards to comms that are going out through the Together Rochdale group. However, that did mean that we needed to go out to recruit. So we've got operational management position up for grabs, and we're going to be recruiting in the month of August. Our interim review programme, and I'm just finalising with the CQC and local adult social care directors which area of the care home system we're going to be looking at, and developing that programme and getting our volunteers ready to get working again in those areas. Pharmacy mystery shopper, which again is going to be a big piece, but a really positive piece, I feel, to really make sure that the communication's out there for residents. We've got the Together Rochdale development. So obviously this is an area that Claire used to run. And like I said, I'm really keen to look at how we can further develop this in the system, specifically looking at the engagement and insight and how we can ensure that local messages are coming out to all of us. So it's a group that come together as statutory partners, so your local NHS, your local authority, and then a lot of the voluntary sector, larger organisations. So we've got a board development session, which is going to be run in September after board recruitment, which will go live from the 7th of August. Really looking at our strategic document once the advisory group have reviewed it and us finalising that there. So looking forward to getting face to face with the board members. It seems to have been a while. And then we've got 2 further reports that will be due out in quarter 2, our menopause phase 2 and our PPG review. So that's everything from me.
Right, thank you very much, Kate. Anybody, any questions, observations on that? Sorry, Melanie, can't hear you.
Sorry. Just to acknowledge what a busy time it is for everybody, and similarly for the work that Naomi's doing that I didn't mention after her report. It's just impressive, you know, given the current staffing levels, that how much work is being done. And yeah, just
thank you very much. I think you absolutely endorse that one, Melanie. Thanks very much indeed. Any other observations?
Yeah, just from me, Margaret. Concur with what Melanie said, that there are lots of work going on. The prescription fines as well, that is especially worrying. Might have missed this. Has this been an issue before, or has it just been sort of flagged now?
Now, do you want to come in?
Yeah, so it's literally, I don't know whether it's because we're doing a lot more seldom heard as such engagement. So I'm at the Refugee and Asylum Seeker Network. I'm at so a lot of these people are, you know, people seeking, you know, refugees are people seeking asylum. And I was at one session the other week, and there were several people who came to it who had been issued fines for NHS treatment that they didn't even know that. So On the back end of it, we've managed to acquire a load of NHS HC1 farms, I think they're called. So we are going to be, I mean, the long farms, the big farms, but, you know, people like the Red Cross, Citizens Advice, it'll be able to sit with people and do these. But it's also looking at when people are new to the area and are new to Rochdale, ensuring that they do know these pathways, that they need to have these farms, they need to fill them in. So it's a little bit of work, I think, around raising awareness of that, which a lot of the organisations are happily on board with, because, you know, more and more people are coming to them. And we've heard it quite a lot at the Strand at Cuckold as well. There were quite a lot of people over there getting fines for dentists and things. And again, they didn't have a clue that they needed these farms. But there are a lot of fines. It's £100 fines, and they don't have the money to pay it. So it's you know, I'm glad it's been flagged up, really, because now we can try and do something about it.
Is it specific to that community, or is it wider as well?
It's a little bit wider as well. So we did have some people report, it was a good few months ago though, around the fact that they transitioned from working tax credit onto universal credit, and under the new transition, when they were on working tax credit, they was entitled to it, but the circumstances might have changed a little bit or whatever. They still presumed they were entitled to it, and then they've now been fined from it. So we did do a few comms and some stuff, basically telling people to check their eligibility, check their awareness, and we managed to get some posters as well from the NHS, you know, for people to check. So it is a little bit wider as well, but, you know, for different things as such, but still people, you know, need to check whether they are eligible.
I know. Oh, sorry, go on.
No, so I was going to bring Melanie in, but if you want to come back in, then Ben, and then bring Melanie.
Yeah, last point then. So I suppose it probably need a little bit more investigation, doesn't it? Now it's been flagged. Do we know if these fines are actually they've been fined? How am I going to say this? They've been, you know, they haven't been wrongly fined. They've been fined by the letter of the system, you know, by the letter of the law, so to speak. And that's the issue. But it's not an issue of like they're being fined inappropriately.
No, it's literally being fined because they've been to a service and got something, and they, you know, like, because sometimes it'll say, I think sometimes the pharmacists are just ticking things as well, you know, like, because sometimes you have to tick it yourself, but sometimes pharmacists are.
Yeah.
So then when it's been checked on, because they do spot checks a lot, you know, on systems, it's flagged up that these, you know, certain people haven't, so that's when they've been issued with the, you know, specific fines. One lady we spoke to did say that she's literally paying it back £2 a month from a benefit, you know, like from her actual thing. So, you know, she tried contesting it, but still have to pay it, but it's £2 a month she's paying. Yeah.
It's hard. But I'm glad you picked up on it and something that we can follow through on. Sorry, Melanie, did you want to come in with?
Yeah, it's just to pick up on what Naomi just said, where people used to be eligible under the working tax credit. They weren't formally notified that changed, as I understand it, when people transferred to universal credit. And now I think some of the confusion now is that if you're on a certain level of universal credit, then you still qualify. But if you're not, because there's a kind of sliding scale, you don't qualify. So rather than anybody getting that information or being informed, they're just being fined.
It does feel draconian, sort of a response to it instead of advisory. Yeah.
At these times, definitely, yes.
Absolutely.
Fined by who?
From NHS, I think it's NHS England, the official letters are from, so yeah.
I just noticed a message from you here, Ben. Thanks, great. I'm happy to get involved in looking further at this issue and champion it. That's great, Ben. Thanks very much indeed.
Thanks, Ben.
Right. If there's any other questions, no observations, is there any other business at all? I've not received any notification of any other business. Right, thank you. So in that case, I'll call the meeting closed. And thank you all for attending.